This is an air bubble. I got my Amazon package this morning, and I'm going to use it to teach you about aneurysm today. So basically what we're going to talk about today is what you need to know about aneurysm for nursing school and NCLEX, and how you can remember it in a way that you will never forget. So if you don't know me already, my name is Nicole Whitworth. I am the founder of Your Nursing Tutor, and I've been a professional nursing tutor for over 12 years. I specialize in helping nursing students make nursing school finally click so that you can understand the information in a way that makes sense for your brain. And then today, in the next few minutes, I'm going to be taking you through the most important information you need to know about aneurysms for nursing school. And I'm going to do it in a way that you can use the same process to apply to any other topic in nursing school so that you can remember those topics just as well also. So I wanted to start. The reason I started thinking about this and decided to do this today is because my husband and I were talking the other day. Now he does not have a medical background. I think we were watching a show or something, and you know how aneurysms are a very convenient way to write actors off of a script when they want to quit because it's just kind of a spontaneous death. And so we were talking about that, and I said, "Do you know what an aneurysm is?" And he said, isn't that like a stroke or something? Which is only partially true. That's only part of the answer. And so I explained it to him. But then this morning I got this package that had this, like, you know, the little air bubble things to keep your things safe. And I said, this is a perfect example that I can show what an aneurysm is. And so I showed it to him. So basically, that's, you know, I'm going to go through and say it. So basically an aneurysm just means a widening. It doesn't, aneurysm by itself has nothing to do with stroke. It has, you know, although you will see how they are connected. And it's basically, it takes a weak spot in the artery wall and it widens it. So that's why I said I stretched it out a little bit and then squeezed it. So I'll do it on this side, just that's the one I made earlier, but just to show you. So it's kind of like, see how right now, if there's pressure, it's nice and flat, right? But if I just make a little weak spot by stretching it a little bit, let me stretch it a little bit more. Then it's doing it in reverse now because of the one on the bottom, I think. See, now you're getting these weak spots up top, right? And so that's basically what an aneurysm is. It's all those widenings versus before it was nice and flat and straight. And now it's really, it's got a spot that's really bulgy, okay? So how can that help you remember everything you need to know about aneurysms for nursing school and NCLEX? Well, let me walk you through the process that I use to teach it. So first of all, aneurysm is a root word in itself that means widening. So if you just knew that, then you would know that it's not specific to stroke, but the root words can actually be really, really helpful in all areas of nursing school. So I actually have a free resource available for you if you go to my website at actually, scratch that. Just go to the link, otherwise I'm going to say it wrong. But if you go to the link I have a free resource called Why is Nursing School So Hard? And as part of that, I include my list of root words that can get you started. And if you sign up for that free resource, I will also email you my best test strategy that uses root words to help you get better grades on your exams. So make sure you sign up for that, totally free. Anyhow, I want to send that to you. But let me take you today through the steps of the 4 steps of the Silver Bullet study system that you can use to understand aneurysms, everything you need to know about aneurysms, not just for stroke, but wherever they happen in your body, so that you can be successful in nursing school and you can start to learn how to apply this 4-step Silver Bullet study system to other areas of nursing school. Okay, first is step 1. I call it the foundational 15. It's where you review the foundational knowledge that you have to have solidly understood and mastered before you can even think about tackling the more advanced nursing topics, like what is an aneurysm, okay? And so in this example, the root words can be your foundational 15. You can use flashcards to study them till you have them solid so that you know exactly what it means when you see the word. And that really plays into the test strategy that I'll send you if you sign up for that free mini training. Okay. So once you've studied, there's some other things that involve too, like if you might want to review your A and P is a lot of the foundational 15. So like A and P of the brain, because you know that happens, A and P of the circulatory system, because an aneurysm is a widening of the arteries most commonly. When we're talking about it in medical terms, of course, an aneurysm is just a widening. But when we're talking about the medical diseases, we're usually talking about it in terms of being in an aorta. And that's where we get to step 2, the Humpty Dumpty factor. I call it the Humpty Dumpty factor because we're asking what is broken. Okay, so we've studied what's normal in step 1 and we've studied that foundational knowledge. Now we're going on to what's broken in step 2 with the Humpty Dumpty factor. So I always say, identify what's broken in 1 sentence or less, okay? And so in this case, it's the artery is weakened and bulging when we're talking about an aneurysm in the body, okay? And so that's pretty much it, okay? It's that straightforward. You don't have to obsess over this. You just get that information from your textbook and you're done. You got that part, because the rest of it is gonna come from steps 1 and 2. When we move on to step 3, it's what I call crystal ball predictions. And I call this because you're about to be a fortune teller and you're going to predict the future. You're going to predict what kind of symptoms and or complications are we going to see or be watching for when this breaks. Okay, and when I say breaks, I mean it's not normal. So it doesn't necessarily mean the aneurysm ruptures, but I'm saying if you have an aneurysm, this is not normal. Okay, so this is not normal anatomy and physiology. So when this happens, then what would we predict would happen next? What are the symptoms we're going to see? And you quickly, when you think about it that way, you quickly realize, wait a second, that's really going to depend on where in the body this happens. Okay? Oh, excuse me, I'm on a video. Please shut the door. No, shut the door, please. Shut the door, please. That's Daddy. I've got 6 kids and I homeschool. So anyhow, we've got this aneurysm here. And where was I? There we go. So we quickly decide, we quickly realize that where this happens in the body is going to significantly change what symptoms we predict, right? That's why it's so hard to just sit and memorize lists of symptoms without understanding why they happen. And it's so much easier to follow this process because then it just makes sense and answers start jumping out at you in exams. So if this aneurysm happens in my brain, then I'm going to have neurological symptoms, okay? And this is where you get that stereotypical stroke that happened because of a brain aneurysm. So if you have an aneurysm in your brain, it can be pushing against the brain, which can cause things like slurred speech, difficulty moving, vision changes. It really just depends on where in your brain the aneurysm happens, right? But it's going to be neurological symptoms. If it ruptures, then you have a stroke, don't you? So next thing is, where's another common place for an aneurysm is aortic aneurysms, okay? So, but the aorta is kind of big and long. So that even can change. If you have an aortic aneurysm, like right near where the arch, where it's coming out of your heart, then that could be pushing against your jugular vein, for example, and that can cause low venous pressure, which can cause symptoms related to that. However, if your aortic aneurysm is down in your abdomen, if it's you have an abdominal aortic aneurysm, then that's going to have different symptoms. That might not have symptoms, but if you're like in health assessment and you're kind of palpating down there, you might feel a big pulsating mass. You want to stop palpating at that point because you don't want it to rupture. That would be a serious medical emergency. But that would be a symptom you would predict if it was down here. So, but you see how instead of just memorizing a list of neurological symptoms and venous symptoms and abdominal symptoms that just kind of make a mess and you don't know how to use them and apply them to an exam, you have now just organized that information very easily based on foundational 15 and what's broken and predicting the symptoms and complications, okay? Now, speaking of complications, of course, the most serious complication we worried about is a rupture, and that is going to be the same everywhere, but the signs of a rupture are going to be different depending on where it happens. But that brings me to step 4. Step 4 I call Finally, nursing care. And this surprises students a lot of time because if you're in nursing school, aren't you there to study nursing? Well, yes, but you can't understand how to use the nursing care until you have the foundational information solid. You need to know why and when to use nursing care before you can properly apply it on exams and in real life, on real patients. So once we get to step 4, you might have to refer back to your textbook, especially if you are still kind of a new nursing student. Maybe you've never heard, well, what do you do for aneurysm? You need to learn that, right? And that's fine. There's going to be some medical care in here because you need to be aware of it and teaching and know what's going to happen to your patient. And then there's going to be nursing care that you can do without, apart from the technical medical diagnosis. But for 4, we're going to have things like, first of all, they're usually asymptomatic. That could have been in step 3, really. But because they're asymptomatic, often we don't know what's going to happen, that they're there until they rupture. And that's a medical emergency. So what kind of things are we going to see and do if it has ruptured? What kind of medical care do we see? We're going to be looking at hypovolemic shock, internal bleeding. If it happens, and again, this is going to change depending on where the aortic aneurysm is. So if it's in the brain, then it's going to be, you're going to see it's a stroke. We talked about that. If it's down in the abdomen, then they're just massive internal bleeding, right? So that's step 4. Now, what you will notice, which you kind of noticed me doing this too, is that the more you study this way with these 4 steps, the more often you will start to find yourself kind of mushing steps 3 and 4 together. Like you'll see step 3, or think of step 3 and be like, oh, I would do this for that. Or if this happens, then I would do that. And it just kind of starts to flow, and it's harder and harder to separate those 2 steps out. That is a good thing because it means that you are training your brain to think like a nurse. That's exactly what you want to happen. It just starts happening automatically as you study this way because you start to see how things and information connect together. So that's good. And this is also why this study method works so well, because if you study this way, then I guarantee that nursing school will get easier instead of harder over time, that you will get to graduation, and that you will have an easier time passing NCLEX and feel a lot more confident on it. And you will ultimately be a safe, effective beginning nurse, which is everybody's goal, because I know you want to be an amazing nurse, and you are an amazing nurse just waiting to happen, okay? So if you'd like some more information and support about how to use the Silver Bullet study system when you're studying in nursing school, then make sure you do sign up for that free training. Why is nursing school so hard? You can get it at yournursingtutor.com/hard. And I will also email you my favorite root words test strategy technique that will help you do better on exams. So until next time, I will see you around. You can find me at yournursingtutor.com or on Facebook on the Your Nursing Tutor Facebook page. See you later.